Pain. It's a common experience that has been treated for thousands of years, yet the feeling of pain varies from person to person, and its source is oftentimes difficult to ascertain.
The pain was so limiting to my life, and I didn't know what I was going to do.
I was unable to work. Pain was on a scale of 1 to 10 was 10 most of the time.
Pain was getting worse and worse. I was to a point where I couldn't hardly walk.
For many years, pain was recognized simply as a symptom. What's really changed in the last 2 decades or so is an awareness that pain can be a symptom of disease, but also can be a disease in and of itself.
The increase in the number of patients with chronic pain is especially a cause for concern, both as a direct and indirect cost to society.
It's such a big problem, it's almost unbelievable. It's been estimated that there are 100 million people in this country that suffer from chronic pain. That 1 in 4 or 5 households has someone living in it with chronic pain.
Economically, pain is a leading cause of disability. Under 45 years of age, low back pain is a leading cause of disability. Its economic impact is $100 billion a year.
And in terms of its impact in the medical arena, we know that pain is the single most common reason for people to seek care from physicians.
An increased understanding of the pathophysiology of pain, along with recent technological advances, has helped doctors significantly in identifying the sources of pain for patients, oftentimes pinpointing its exact cause. Successful pain treatment today, especially chronic pain treatment, involves applying an array of evidence-based pain principles.
There's a lot of treatments. Pain is so common. It's such a ubiquitous condition that there's lots of treatment that's anecdotally based. It's not based in sound medical principles. And when that happens, you don't get the outcomes that you could. When you use solid evidence basis for what's going on, you give the patient the best chance for long-term relief.
It has changed in the sense that we are better able to make a diagnosis because of advanced technology. We're able to find that there are a lot more nerve sources for pain than was suggested earlier. So as you advance and you're able to find smaller nerves, you're able to realize that that is actually a structure that could be a pain generator.
First and foremost, an accurate diagnosis is the cornerstone of successful pain treatment today. Once an accurate diagnosis has been made, today's advancing technology allows for a variety of treatment options that can be targeted to each aspect of pain origin.
Like much of medicine, the invasiveness is decreasing with time. We're able to do things percutaneously that reduce pain far more frequently. So we avoid the need to have surgery sometimes with long rehabilitation periods. Basically, we're doing things through needles that we used to have to open up and perform big incisions for.
What has allowed us that efficiency is the technology and the ability to diagnose painful processes just like we diagnose other things in medicine, including the heart and every other organ system in the body.
The benefits of pain treatment can be immeasurable with strict adherence to evidence-based outcomes.
If we can target our therapy to the source of pain, in this case one particular disc in the lumbar spine, we have a much greater chance of long-term success.
I think an important part of how you treat pain is to treat it sooner. And they realize over time that the nervous system actually adapts to the pain and creates a more chronic condition. So the sooner you treat pain and the more aggressively you treat it, the less likely they are to go on to chronic pain conditions.
It just gave me such a good feeling. I was able to walk and, you know, I could take off and go to the mall with one of the kids and shop all afternoon. I wasn't, you know, sitting there watching them.
I was able to work out and strengthen those muscles and get back in shape again so that I am able to, you know, do my daily living without pain.
The ultimate goal of pain medicine is not only to decrease pain, but improve quality of life for those in pain. Located in the capital city of Lincoln, Nebraska Pain Consultants is dedicated to the diagnosis and treatment of pain through the application of evidence-based medicine. As the first comprehensive pain management program in the state of Nebraska, Nebraska Pain Consultants has led the way in treatment of chronic pain conditions since 2001.
Our mission is to reduce pain and improve functional capabilities, that is, the quality of life for our patients.
We cure pain when we can, but more importantly, we always treat suffering.
By using a full array of interventional pain management techniques along with contemporary imaging, nerve ablation, and neuromodulation technology, Nebraska Pain Consultants is uniquely qualified to address a broad spectrum of pain conditions, ranging from simple back pain to sports injuries to chronic pain.
I believe NPC is unique because we're able to use advanced technology and apply it to each individual and their specific pain condition.
With a team of physicians board certified by the American Board of Pain Medicine, Nebraska Pain Consultants works with a broad network of primary care physicians, neurologists, surgeons, therapists, chiropractors, massage therapists, and cognitive behavioral health specialists to coordinate a comprehensive approach to pain management to improve the overall quality of life for its patients.
Well, we've certainly come a long ways from the days of having the patients bite a bullet and take a shot of whiskey. And a lot of that reflects the fact that the basic scientists who've been working on this, the clinical scientists, have dramatically improved our understanding of what causes pain. As our understanding of the basic causes of pain has improved, we've been able to greatly expand the number of ways that we can manage pain.
The most pride that I get is knowing the fact that, on average, every patient that comes into this office has seen at least 4 other physicians with their pain complaint. Now, what that results in is being bounced from doctor to doctor to doctor and not getting their pain issues addressed. Everyone on this staff and in this building is committed to the treatment of pain and to listen to patients' problems and to do our best to improve their quality of life.
For more information, visit nebpain.com.